Did you know that almost 30% of my caseload per week in my clinic are ear infections in children? Typically those aged 2 to 5. And this is known as otitis media, infection of the middle ear. Let me tell you more. Otitis media is basically inflammation of the middle ear, right? Not only confining to the middle ear, but also this Eustachian tube. So basically this Eustachian tube is like a bridge connecting the middle ear to the nose. So what happens is the middle ear space becomes inflamed. It gets filled up with fluid. So you might ask me, where does this fluid come from? So this fluid is not from the external ear, it's basically from your nose. So let's say typically when you get a common flu or cold, the fluid from the nose travels up through the Eustachian tube and blocks the middle ear space. So this is when you start having the symptoms of otitis media, right? It typically affects the children within the age of 2 to 5 years old because they have a shorter Eustachian tube. It's way much shorter, provides less resistance for fluid from the nose to enter. It is like a direct pathway entering into the middle ear. So this bulge fluid will result in pain, fever, and then they'll become symptomatic. And some may have persistent otorrhea or ear discharge. Typically, it is caused by your common bugs, common viruses. Usually resolves within few days. But when it becomes more sinister, gets infected by bacteria and such. So what happens? This fluid in the middle ear becomes more turbid, more copious. Then it results the pressure building up. And then it becomes more painful. And when the pressure builds up, it bursts the drum. So then you'll have a perforation in your drum, right? So this can lead to deafness, conductive deafness typically. But if you leave it untreated, then it can become permanent deafness.